Good morning. Welcome to Active Aging with Barb. My name is Barb Eisenberg. I'm a physical therapist assistant and also a licensed massage therapist. Thank you for joining me. So I am a physical therapist assistant. I work for Therapy at Home, and we are a provider of physical, occupational, and speech therapy services. We have a website that's tahcares.com. So I hope you'll check us out and find out if there's any way that we can help you. We would be happy to work with you. And we come to you, so no need to worry about transportation. So as therapists, we work a lot on preventing falls because falls can be a horrible thing. They can cause terrible injuries. And it's one of the main things that we work on as therapists. And as we age, there's an increase in risk for falls, but it's not inevitable. There are things we can do. But the problem is it's the number one cause of traumatic brain injury like concussion. It's 95% of the hip fractures are due to falls. And when you're over 65, it's the leading cause of death related to injury. It's a terrible thing. So it's a terrible statistic. Wisconsin has the highest deaths from falls in the whole country of any state. And it's not something that we're proud of. We really need to work on that and reduce the number of falls that we have in Wisconsin. It's 157 deaths per 100,000 people. The only states that are close to that are Maine, which is 140, and Vermont, which is 142. So it's a terrible statistic, and we really need to work on preventing falls. Lots of things we can do. We need to stay strong, and you're doing that by coming to this exercise program, and we need to improve our balance, which we're also going to work on during the exercise program. We always do some strengthening and some balance work, and they work together. So prevention is very important, but another factor is if you do have a fall, because sometimes they just are unavoidable. If you do have a fall, what happens when that happens? If you have a fall and you have a fracture, if you fracture your hip, you be hospitalized, there can be complications, you can get an infection, you can get pneumonia, and sometimes it can lead to death. So it's a terrible thing. But if you have a fall and you don't have a fracture, maybe you're just a little bruised and you get up and you're feeling better in a couple of days or the next day, much better outcome, much, much better. So that is what we were looking for. If you do have a fall, we don't want you to have a fracture. And that means you have to keep your bones strong and prevent what they call a silent disease, osteoporosis. I'm sure you've heard of it. It's a fairly common disease in America. It's called the silent disease because there's often no indication, no symptoms that you notice. But there are some things that might be indicators that you might have osteoporosis. One of them is pain from a vertebral fracture. So you might have a fracture in your spine somewhere and you're having pain, but you don't even realize that there's a fracture there. Also, a loss of height. So going to the doctor every year, you notice that you're shorter than you used to be. And changes in your posture. Some people call it a dowager's hump when you get very rounded shoulders, kind of walking like this. You get a hump in your back. That is increased kyphosis. Generally, there's a very small curve in your upper back, but an accentuated curve, that dowager's hump, is an indicator that you may have osteoporosis. So those are the things you want to look for and get it checked out. So how do you know for sure? There is a scan. It's a bone density scan called a DXA, and it's a dual energy absorptiometry. I had to work on that word. That measures your bone density, and it usually looks at the density of your hip bones and your spine, your vertebra. It also sometimes looks at your forearm bones. So who should have a bone scan? The National Osteoporosis Foundation recommends any females over 65 or males over 70 with a height loss of 1/2 inch in a year. So if you've lost a 1/2 inch since your last doctor's appointment, check with your doctor and have them schedule a bone scan for you. Also, if you've just had a total loss of height since your highest height of 1.5 inches, And if you are 50 or older and you've had a bone fracture, it's always a good idea to get a scan to make sure that you're not having a thinning of the bones or a weakness in your bones. So what can we do to prevent it? We need to also look at risk factors. If you have risk factors, even if you're not over 65 or 70 and you haven't noticed a loss in height, you really need to think about getting a bone scan and working on reducing some of these risk factors. One of those risk factors is inadequate calcium and vitamin D. Those two nutrients work together to help you build bone in your body. Cigarette smoking, huge no-no. Big factor in osteoporosis. Alcohol intake, any more than 2 drinks a day for most people is going to be detrimental to your health. And also excess caffeine, more than 3 cups of coffee or the equivalent of caffeine a day. So energy drinks, anything that has that excess caffeine in it can cause, interfere with your body's ability to build bone. Lack of physical activity. So if you don't move around much, I'm glad you're here and you're watching and you're going to join us with the exercise. That's a great start to getting moving. And also another factor is a long-term use of certain medications. You may be using them to treat rheumatoid arthritis or asthma. The corticosteroids are known to affect your bone density. So if you have to take those medications, you probably want to get a bone scan and check on your bone density. And the other factor is women who have gone into menopause early. So at under the age of 45 would be early menopause. So in order to prevent osteoporosis, you look at all those risk factors and you check them off one by one. You reduce, you eliminate them, quit smoking, quit drinking, lower the amount of alcohol. Do that as much as you can. Reduce the caffeine or eliminate the caffeine as much as possible. Get moving. I'm glad you're with us because you're going to get moving. So simple things to do to get moving. Walking is a weight-bearing exercise. So if you're on your feet, you're doing a weight-bearing exercise. Yoga, dancing is a great thing. Skating, cross-country skiing, anything like that. If you're swimming or you're riding a bike, those are great exercises for other things, but not for building your bone density. Keep doing them though. So other things, healthy diet. So lots of fruits and vegetables and whole grains. They're good for lots of reasons, but they're going to have those nutrients that help you absorb the calcium and help your body do what it needs to do to build bone. Vitamin D. Vitamin D, oftentimes we can get it just from the sun. When the sun hits our skin, we can make our own vitamin D, but in our latitude where we are, not very close to the equator, the sun's rays are not that direct in the wintertime. So from about end of March to beginning of September, spending time outdoors in the middle of the day, 5 to 15 minutes, can often give you enough vitamin D. You don't need any kind of supplement. But in those winter months, in this latitude, you probably need a supplement. You can talk to your pharmacist or your doctor about what type of supplement would be good for you. And so vitamin D is very important. If you have enough vitamin D, it decreases your risk of fractures by 25%. That's huge. So remember vitamin D, especially this time of year for us. And low vitamin D, if you have low vitamin D, you're only able to absorb about 10 to 15% of the calcium that you take in. So it's a little complicated. If you don't have enough vitamin D, you can be taking in all kinds of calcium, but you're not absorbing it. So really important to have those two things together, the vitamin D and the calcium. And remember, quit smoking, keep trying, work with your doctor. There's a federal program, free federal programs to help you quit. Keep trying until you're successful. I know you will. You will be. So calcium, best way to get it is from food. Leafy greens and beans, greens and beans, greens and beans. great nutrients, especially calcium, lots of other things, lots of fiber in greens and beans. We talked about that in past videos, how important fiber is in your diet. So broccoli, Brussels sprouts, cauliflower, collards, kale, mustard greens. The only ones that aren't good at that absorption is spinach and chard. So not so good for calcium with spinach and chard, but good for other reasons. So for beans, baked beans, garbanzo beans, tofu, which is made from soybeans, edamame, which is also another name for soybeans. You can get them in the frozen food section, thaw them out, and snack on them like peanuts. They're a really good little green bean. And the great thing about the beans is that they have magnesium. Magnesium is also helpful to help your body build that bone back. Another way you can get calcium is from plant milks and from fortified orange juice. So look for orange juice that's fortified with calcium and vitamin D. Plant milks like soy milk, almond milk, flaxseed milk, rice milk. Check the label though. I noticed that my flax milk that I used the other day has both calcium and vitamin D, so they'll be able to work together to help me absorb that calcium and keep my bones strong. So, a lot of information today. I hope you got a lot out of it and you start making some positive changes. One of those changes is getting moving. So, let's get to our exercise. And we always start with a warm-up. So let's start side to side. And breathing deep, side to side, side to side. Remember, if you're stepping side to side, you're working these hip joints and hip muscles. These side hip muscles are really great for balance. So we're already getting involved in fall prevention just by stepping side to side. Good work. Side to side. If you want to add an arm, that increases your heart rate. We want to strengthen all muscles, including our heart muscle. So remember, if you don't use it, you will lose it. So muscles that you don't use will get weaker. That's just how your body is put together. But if you use them, they will get stronger. And if you challenge them, they will get stronger. Good work. Step and stretch. And let's do a kick. Kick and kick. And I like to bring in the arms a little, get your blood flowing in your shoulders and your elbows. Kick to the side so you get a little bit of a stretch. Getting your knees going. Circulate that synovial fluid. Joints are just like hinges. They need to move and they need to be lubricated. Kicking to the side. Good job. 10 more seconds and we'll change it up. 3, 2, 1, and kick to the front. Kick to the front. And I'm just gonna, you can do anything you want with your arms. We're still warming up, trying to stay relaxed. But you'll notice anytime you lift your arms over your head, you're gonna start breathing harder. So you get more of a cardiovascular workout when you get your arms over your head. The other way is just to pick up the pace. If you want more cardio, just go a little faster. And side and tap. Side and tap. Breathe nice and deep. In through your nose, out through your mouth. So if you bend your knees a little more, you're going to help pump that blood through your muscles, through your quad muscles, that's the upper thigh, and the calf. And we'll add an arm. Tap and reach. and reach. All right, good work. Let's reach to the front. Let's do a punch. So you're extending through your elbow and your shoulder, getting a little shoulder stretch. Step and reach. You do it at your pace. Remember, you want to stay in your comfort zone. But you also want to challenge yourself a little bit. So you have to decide what that level is for you. And wherever you start, you just go forward from there. You're not trying to compete with anyone but yourself. Just trying to make your body stronger, more flexible, better balance. Good work. And reach up. Reach. Reach with 1 and 2. I'm breathing harder. I hope you are too. That means we're getting some cardio here. Reach 1 and reach 2. Pretty simple movements, but they are powerful. Getting that blood flowing. Good work. Now let's go to the side. Reach to the side. So a little more rotation in the spine. It's important for your spine to move in all directions. Helps with posture. Good work. And it helps prevent pain in your back if it can move in all different directions. All right, now that we're warmed up, let's loosen up the shoulder and the spine some more. So big figure 8, starting small and getting bigger. Big circle front and behind if you can. And trying to get bigger, reaching further up to the ceiling and further down toward the floor. And if you need to use your chair for balance, you can do that, but try to challenge yourself. Reaching up high and down low. And behind. One more. And behind. I can hear my back loosening up. It's making noise. That's okay. And switch arms. So starting small. This is one of my favorites. I hope you like it too. Because I'm just moving my arm, but that's what it looks like. It's also my shoulder. It's my upper back. It's my lower back as I get lower. And it's my legs. So it's almost full body movement here. Reaching further up, further down, and further behind. Circle, big circle. Circle, and behind. Circle front, and circle behind. Circle front. One more. All the way down if you can. All the way up and behind. Let's do both arms together. So circle, pull your elbows back and out and bring them forward. So back with the elbows, up with the elbows, bring them forward, rounding your back. You should feel this in your lower back because you're pulling in both directions. Back with your back, forward with your arms, and around. Elbows back. Let's turn sideways so you can see. Back with the elbows so the shoulders are stretching. Then out with the elbows, rounding your back, lifting up, and then arching your back. So here, get a little arch in my back. I'm using my elbows like a lever to pull my shoulders forward and then pull them back. Shoulders forward and shoulders back. Forward and back. Forward and back. Oh, back's feeling better. Okay, let's reach up a little higher and over to the side and down. Reach up higher, really stretching here, over to the side and down. Up, higher, over and down. Up, reach higher. You want to lengthen before you strengthen. Keeping the muscles long and strong. All right, let's use our chair to work on the calves a little bit. Going up and down, up and down. Strong feet and strong calves will give you a nice stride when you go for your walk, because we know you're walking every day or almost every day. That's a great simple physical activity, weight-bearing exercise, strengthening your bones. If you do it at the right speed, getting your heart rate up, strengthening your heart muscle. Good work. Up and down. So we're strengthening calf muscles. Now if you bend, you stretch them out a little bit and push up. Bend, stretch out the calf, and up. One more time, bend, and up. Let's do a couple on one leg. So lift up one leg, bend that leg, and then up on the toe. Use that chair for balance. Bend that leg so you're working the quad, and then up on the toe. Bend that leg, work that quad, push up, and up on the toe. Very simple. We doubled the amount of weight this muscle has to do just by lifting that leg. All right, no weights needed. You're using your own body weight. So we'll start a couple to warm up and down. Bend the knees and up on the toes. Now let's try one leg on the left leg. So bend that knee and up on the toe. Bend that knee, push through that quad, up on the toe. I'll do two more. Bend that knee, up on the toe, bend that knee. If it's too much to have one leg up, just do it with two. And loosen it up. Good work. All right, let's go to hips. So we're going straight leg in front, lifting up, 3, 4, 5, and then to the side. Point the toe, 3, 4, 5, and this time flex for 5, 4, 3, keeping everything nice and tall. And to the side. Toe is pointed forward. When you do the side leg lift, keep your knee pointing to the front. If you turn it out, you're not working the same muscles. So 5, 4, 3, 2, and 1. Let's switch sides. Toe out in front, lifting up for 5, 2, and 1, and out to the side. Point the toe. Need a little more room here. And flex the foot up in front for 5, 4, 5, and out to the side for 5, 4, 3, 2, and 1. More hip work. Strong hips, really good for your balance and good for getting off a chair, getting off a couch, going upstairs. So knee is bent, pushing back for 8, 7, 6, 5, 4, 3, 2, and 1. Other leg, knee is bent, pushing back for 8, 7, 6, 5, 4, 3, 2, 1. Good work. Let's go in the front again. This time Your knee is going to be bent and turned out to the side a little bit. And we want to lift. This is a little awkward. We're going to go for 5, 4, 3, 2, and 1. Strengthening the inner thigh. Sometimes really weak on some people. So we need to work it. We don't want any muscle to get weak. Toe out in front, bend the knee, turn it out, and lift up for 5, 4, 3, 2, and 1. Let's do that again. I can tell I need this one. So knee out to the side, leg up for 5, 4, doesn't have to be a big motion, 2, and 1, and other side. Bend the knee out to the side and lift for 5, 4, 3, 2, and 1. Let's do a similar thing going to the back. So knee is bent and turned out, but this time we're lifting to the back. 4, 8, 7, 6, 5, 4, 3, 2, and 1. I'm going to move my chair so you can see what I'm doing. So knee bent and knee out, lifting to the back on an angle for 8, 7, 6, 5. Trying to keep real tall. So even though we're working the leg, we're also working posture, working core, just by standing tall. 2 and 1. Good work. All right, let's do some more quad work. Quads are really important for your daily activities, climbing stairs, getting off a chair. Simple quad exercise. Remember, we've talked about it in the past. Just standing up and sitting down. Do it 10 times in a row. You will feel it for sure. All right, so feet wide apart. You want to keep your knee over your ankle. Don't let the knee go past your toes. Okay, so you want a wide base of support, and we're going down for 3 and up. Down for 3, 2, 1, and up. Down for 3, 2, 1, and up. 3, 2, 1, and up. 3, 2, 1, and up. You're trying to keep your knees pointing to the side. So don't let your knees turn in. If you have to bring your feet close together, that's fine. So we're going down for 3 and up. Down for 3, 2, 1, and up. Let's stay down for a little bit. So stay down, reaching up and up, reaching forward and forward, pull back, push down, push down. So we're working the triceps, pushing up and up, forward and forward, down and down, out and out, up and up, forward and forward, down and down, keeping that squat if you can, that plie, up and up, forward and forward, down and down, out and out. All right, now we're going to go elbow to your knee if you can, or in that direction. So we're working the core again. Elbow toward the knee. Elbow toward the knee. And other side. If your legs start aching, that's normal. If you can't stand it anymore, just stand up, shake it out, and get back to it. So side, back to center, side, back to center, side, and center, side, and center. Just a couple more. Hold on, you can do it. I know you might be feeling a little burn there. That's just the muscle becoming fatigued. And that means you're getting stronger. 3, and 2, and 1. Up, shake it out. You might want to give it a little rub, a little tap. That helps. All right, let's do a little bit of a lunge to the front. So big step forward lower down, keeping that knee over your ankle, bending the back knee, and then push back. Use the chair if you need it. If you really want to work your balance, go without the chair. Step, lower down, just to your level, push back. Step, lower down, keeping that knee over your ankle, push back. Step, lower down, push back. Step, lower down. We'll do 3 more. Step, lower down. Great for hips, great for quads, great for hamstrings. This is kind of a total leg workout. 1 more. Even working my feet, I can feel my feet stretching. All right, other side. Big step, lower down, and back. Step, lower down, trying to keep totally upright. Don't bend at your hips. Step, lower, so you don't want this. You want to stay upright. Working that core. Lower down and back. Just go to your level. If you're just doing this, that's fine. Smaller step, a little smaller lunge. You're still working those muscles, still getting the benefit. As you get stronger, you can try going a little lower. Let's do 3 more. I kind of lost count. And 2 more. And 1 more. Good work. Really feeling the stretch in my feet. That's a good thing though. So let's circle with the ankles. Both directions. And circle the other ankle. And back. Good work. A little more hip work. So lifting your knee up and then bring it out, back and down. If you can, try not to use your chair too much. Then you're working your balance as well. Out and down, knee up, out, back and down. 4, back and down. 3, out, back and down. 2, nope, working my balance reflexes. And last one. Good work. Other side, knee up. This one's harder because I got this, still have this toe injury that I'm recovering from. I think a little baby toe doesn't do much, but it really changes your balance. Up, out, back and down, 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 up, out, back and down. 3 more. Up, ooh, out, back and down, up, out, back and down. Last one. Out, back and down. All that wobbling, balance reflexes, messages from your body to your brain, how to stay upright. Really important. Preventing falls, working your balance reflexes. Good job. All right, let's just do a little neck rotation. Look to one side, hold it and breathe. Look to the other side, hold and breathe. One more time. Turn, hold and breathe. Everything else is tall and straight. And there, we got about 4 more minutes. Let's step forward and back, forward and back, forward and back, forward and back. Side to side, side to side, side to side. Let's do up for 3, and up for 3, up for 3, and up for 3, up for 3, and up for 3, up for 3, and up for 3. Good work. Forward and back, forward and back. So you can do a tap, or you can do just a lift. So you're stopping, one leg up. Make it more difficult if you are up to it. Or do a tap. Tap, tap. So you're getting ready to stand on one foot, but not quite there yet. Tap, tap. Almost all the weight is on one foot. So one of the studies that they've done is an exercise that's just called single leg stance. It's standing on one foot, and they found that you can increase your the muscle strength in your hips, and they actually found an increase in bone density just by doing this exercise 3 times a day, 1 minute each leg. And we'll be coming up and we're going to finish with that. So up and back, and I'm going to switch, stepping with the other foot for 8 more seconds, 7, work and balance, 6, 1 more. All right, 1 minute, 1 leg. This is the whole exercise, just standing on one leg. You can use something for balance, but trying not to. 1 minute, standing on one leg, 3 times a day. You're building your bone strength. That's it. Weight bearing exercise. Very simple. 6 minutes a day. I'm sure you can fit 6 minutes in every day. You know you're going to be building bone density just by doing that. 6 minutes. Not much excuse for not doing 6 minutes a day. Sure, you can fit it in somewhere. 2 minutes in the morning, 2 minutes in the afternoon, 2 minutes at night, right? Very simple. 2 minutes. We're almost done with this leg. 8 more seconds. And you want to work up to where you don't have to hold on. Then you really know you're working your balance, strengthening that hip joint. Other leg. Standing on one foot. Trying not to hold on. Working your balance, building your bone strength. When you do this, you don't want to let that hip drop, the opposite hip drop. Then you're really strengthening that hip muscle. It's this hip muscle that keeps that hip up. So standing tall, all the weight is on one leg. You're building that strength in these leg muscles in the bones. Telling your body to increase that bone creation in your hip. 15 seconds. Good work. See if you can let go for a few seconds. Your ankle's going to wiggle. That's perfectly normal. 5 more seconds. 3, 2, 1, and down. You made it. Let's take a couple deep breaths to finish up. Give yourself some gratitude. Whoop. Nice deep breath. Release any extra tension that you built up while you're doing all that work. In through your nose and blow it out. Remember, you have the power to change your body just by what you do with it, what you put inside it, and what you think. Your thoughts actually affect your body. So be well, stay strong. See you next time. Bye-bye.